Hearing your baby cough for the first time can be a very startling experience for any new parent. It is completely natural to feel a wave of worry wash over you. Every little sound can feel like a major event. A tiny sneeze, a deep cough. You are tuned into your baby's every need and every change. This is a normal part of being a loving and attentive parent. It is important to remember that babies, just like adults, get sick from time to time. Their little immune systems are still developing. They are learning how to fight off common germs. Understanding that coughs and colds are a common part of infancy is the first step to managing your anxiety. Your baby is exploring a brand new world, exposing them to viruses. Most of these illnesses are mild and will resolve on their own. With time and a lot of loving care from you. Provide comfort and support. Keep a watchful eye for signs of something more serious. This knowledge will empower you. Babies have very small airways. Even a small amount of mucus can sound dramatic and loud. A little stuffy nose can cause snorting sounds. Post-nasal drip can lead to a cough. Think of these sounds as your baby's body working to clear things out. Although distressing, these sounds often mean the body is doing what it should to get better. Let's talk about the different sounds you might hear. A common cold is usually the starting point. It is a viral infection of the nose, throat. You will likely notice a runny nose with clear mucus. That mucus may thicken and turn yellow, or it may turn green over a few days. Your baby might also be sneezing a lot and have a slight fever. A cough associated with a simple cold is often a wet-sounding cough. This is caused by mucus from the nose dripping down the back of the throat, which is called post-nasal drip. This cough can sound worse when your baby is lying down. Wheezing is a different sound. Listen carefully. It is a high-pitched whistling sound that happens when your baby breathes out. It is not the same as gurgling or rattling sounds from mucus in the throat. Then there is croup, a very distinct, memorable cough. Croup is a viral infection causing swelling in the upper airway, specifically around the voice box, the larynx. This swelling leads to a harsh, barking cough. It often sounds a lot like a seal. The cough is often worse at night and it may appear suddenly. Along with the barky cough, your baby might have a hoarse cry and make a high-pitched, noisy sound when they breathe in. This is called streeter. When your baby has a cough or cold, your main goal is to keep them comfortable. One of the most effective and safest things you can do is to use saline drops or saline spray. You can buy these over the counter at any pharmacy. A couple of drops in each nostril helps thin out the mucus, making it easier for your baby to clear it out. After using the saline, you can use a nasal aspirator, like a bulb syringe or a nose Frida, to gently suction the mucus from their nose. This is especially helpful right before feedings and before they go to sleep, as it helps them breathe more easily. Keeping the air moist is another wonderful way to provide relief. Dry air can irritate your baby's throat and nasal passages, making a cough worse. You can use a cool mist humidifier in the room where your baby sleeps. The moist air helps to soothe their airways and loosen congestion. If you do not have a humidifier, run a hot shower to create a steamy bathroom. Sit in the steamy room with your baby for about 15 minutes. This can be especially calming for the harsh, barking cough of croup. Hydration is also incredibly important when your baby is sick. Babies need plenty of fluids to help thin mucus and prevent dehydration, especially with fever. If you are breastfeeding, offer the breast more frequently. If your baby is formula-fed, continue regular feedings. Offer smaller amounts more often if they won't take a full bottle. For babies over 6 months, you can offer small sips of water. Finally, remember, rest is essential for healing. Your baby might be fussier and need more cuddles and comfort. Allow them to sleep as much as they need to. Hold your baby more upright to help drainage and breathing, especially with heavy congestion. Do not give over-the-counter cough and cold medicines to babies or young children. It is crucial for parents to know the difference between a common cold and croup, as their management can differ. A common cold typically starts gradually. Runny nose, mild cough. The cough is usually wet and phlegmy. Your baby might be fussy but can often be comforted. Croup, on the other hand, often starts suddenly, usually in the middle of the night. The defining feature is a tight barking cough that sounds like a seal. A baby with croup might also make a high-pitched noise called stridor when they breathe in. This is a key difference from the rattling of a cold. Both are caused by viruses, but the location of the swelling is different. In a cold, the inflammation is mostly in the nose and throat. In croup, the inflammation is lower down, around the voice box and windpipe. A cold will rarely cause significant breathing trouble on its own. Croup, however, can sometimes narrow the airway enough to make breathing difficult. Watching your baby's breathing pattern is the most important thing you can do. A cold is a nuisance, but croup has the potential to be more serious and needs careful monitoring. Knowing the red flags that signal a medical emergency is vital. You should seek immediate medical care if your baby is having trouble breathing. Fast breathing, flaring nostrils, retractions, when the skin between the ribs or at the neck sucks in with each breath. If your baby's lips start to look blue or gray, if your baby's face looks blue or gray, if your baby's tongue looks blue or gray, this is a sign they are not getting enough oxygen. Call emergency services right away. Also, if your baby is unusually lethargic, difficult to wake up, not drinking, or showing signs of dehydration, they need to be seen urgently. Parenting is a journey of learning and love. It's okay to feel worried when your baby is sick. You are more than capable of handling it. You are your baby's best advocate. You are doing a great job.